All right, good evening, everyone, and thank you for joining us for this AOGME Transitions in Medical Education Series webinar featuring interactive breakout discussions hosted by the AOGME Residents and Fellows Council, which is the RFC. My name is Linda Logan, and I'm a PGY4 Combined Anatomic and Clinical Pathology resident at the University of Vermont Medical Center in Burlington, Vermont. And I'm also currently the chair of RFC, and I'm going to be facilitating this session today. Before we get started, I wanted to review a few housekeeping rules. The opening panel will be recorded. The breakout sessions, unfortunately, are not able to be recorded. So feel free to submit any questions into the chat at any time, and we'll do our best to answer all of them as best as we can. As well as please remain muted at all times during the opening panel to alleviate, distractions. And you'll be able to unmute to ask questions to the panelists during these breakout sessions, which is the purpose of it. If you experience any technical issues, please use the chat feature and one of the AACOM staff members will go ahead and assist you. So starting off, I would like to take time right now to thank the residents who are joining us today to speak and volunteering to be an opening panelist. They're going to share their experiences, perspectives, and advice on what to do after the match. And so I thought it would be a good idea to take some time to introduce yourselves, your name, what year you are as a resident, your specialty that you're in, maybe the institution where you're located, and a brief tip on, maybe what you wish you would have known before the match, or a tip like that for our attendees. And we can start with whoever would like to go first. So I guess Maria, are you on?
Yeah, I'm here.
Wonderful. Hello.
Good, thanks, Linda. Hey, everyone. My name's Maria. I'm a third-year resident PGY3 in emergency medicine and internal medicine at Christiana Care in Delaware. Went to Unicom in Maine, though, so I have kind of experience in a couple places on the East Coast. And excited to be here with everyone. I'm currently the vice chair of the RFC e-board. And I guess something I wish I knew before the match is to kind of, once the process is complete, to enjoy yourself and not like be stressed, which is hard. Once you've kind of submitted your application and gone through that process, to just know you did everything you could and know you have, left it all out on the field, and then just take a moment to kind of relax and reset before residency starts, because once residency starts, you're gonna hit the ground running.
Awesome, thank you for that. Jansen?
Yeah, hi everyone. My name is Hanson Tang. I'm a PGY1 studying internal medicine at Western Michigan University in Kalamazoo, Michigan. One of the tips that I think that was really helpful for me, that another fellow older resident had told me before I had became a PGY1 was that, as an incoming intern, you're essentially on the same footing as most of your other peers. I mean, everyone starts from square one and we all have to start from somewhere. So I wouldn't worry too much about, stressing about things and trying to get ahead of the game. But I think ultimately you're all there to learn, and it's an ongoing process. So.
Awesome, thank you. Bree?
Hi everyone, my name is Bree Howerton. I'm a PGY1 in emergency medicine at Beaumont Health in Detroit. I would say after the match, kind of just remembering that the people who have supported you throughout these last 4 years and probably haven't seen much of you finally have time to see you, and you finally have time to see them. So relax, settle into your new city, be motivated to work hard when you get there, but try to have fun. Try to get back to some of those people who spent so much time supporting you from afar, because it'll happen again for the next 3 or 4 or 5 years, depending on what your residency is.
Awesome, thank you. And Ashley?
Hi everyone, my name is Ashley. I also went to Unicom in Maine. I also did, so I'm an intern for a second time this year. I actually did a preliminary year last year. So I got to be an intern twice. So lots and lots of advice. And the biggest one is budget. I had to move across the country twice now in the past 2.5 years, and it's always way more expensive than you think it's going to be. So definitely save your dollars, but have some fun and relax too in these next couple of months.
Awesome, great. I've also moved across the country, so I echo what Ashley said. It is quite expensive, and I agree with what everyone said. I guess I didn't give my tip, but I would just say do your best to prepare for, going back into the workplace. You're going to be, back at a job. You're not a student anymore. We're lifelong learners per se, but you work, you're working for 12 hours of sometimes, and so just enjoy your time, as everyone's alluded to, and just try to put your working, your employee cap back on rather than student cap, because it does feel a little bit different in the beginning. But I think it's better. Residency was better for me. Okay, so those are some great introductions. I think it would be nice to discuss some other important topics, what to do after the match. So feel free for the opening panelists to kind of just speak up when you feel compelled to speak. So I don't have to call on you per se. But what are some tips or advice or important things to consider when relocating to a new city or state from residency? So I guess, Ashley, that actually might be a good question for you to start.
Yeah, having done it twice, obviously, in my preliminary, like, really take into consideration how far away your apartment is going to be from the hospital and how early you have to be at the hospital. Last year, I was 10 to 15 minutes from my site, and my hours really weren't that bad. I had to be there at 6 a.m. Now, however, being in surgery, I'm usually up at 4:30, and I have a 35-minute commute to the hospital, and it's just a little too long, and I'm regretting it. So take that into consideration, practice the drive if you have the opportunity to go and actually look at these places in person. It's going to save you.
I would second that. I moved 6 hours from where I was fourth year, but I moved 1,200 miles my fourth year getting ready for match. So I would say I would second what Ashley said, know your commute and what is a maximum commute that you're willing to do. And then I would say talk to some of the seniors or some of the interns and talk about like moving, what are safe spaces, what are like less safe neighborhoods, because sometimes it can be really appealing to pick a cheap spot, and there are some cheap spots that are not worth it. Some of them are, but you want to be well informed when you do that. And then also kind of like in the commuting way, if you are in a place that's going to have snow, are you prepared to add an extra 15 or 20 minutes to whatever commute you start with? Because here in Detroit, it doesn't snow a ton, but when it does, it adds a significant chunk of time to your day. So
Just to also add on to what Bree and Ashley have kind of mentioned, I also moved long distance and across the country. So another thing to think about is at some point, however you're getting there, whether it be flying or via driving, at some point you're gonna run out of space of, being able to putting like things and furniture. So I would really just try to reevaluate, like, do you want to build things or do you want to repurchase things in, a different state? Do you have an IKEA nearby? Yeah, just keeping those things in mind, I think would be a good idea.
Awesome. Thank you. I moved from Utah to West Virginia for medical school, and then I moved from West Virginia to Vermont. So I've kind of done across the country and then like north. Um, I will say, everything everyone has said is true. We did bring a lot of things to Goodwill, as Hanson alluded to. It's important to, um, you know, reevaluate how simplistic you want to live versus maybe not. Other than that, save a little bit, like Ashley said, if you're able to. And then also think about all the different types of moving opportunities that are out there. There's pods out there, there's moving trucks, there's more than just paying for movers. Not a lot of us can do that at this point in time. So just remember that there's different options that you do have to move all of your stuff as well, which I didn't know any of that until I had to do the big move. But great tips. The next question here is, what should we do to prepare financially for residency? And how much money should we save for a transition period before we start getting like our first paycheck?
So that's a good question. I feel like I probably wasn't the most frugal, and I just kind of whittled my bank account to like negative nothing and use the money to like see friends and like do things. But at least where I started, we have orientation like the last 2 weeks of June, and we got paid for those 2 weeks, and we get paid every 2 weeks. So like my first paycheck came like right at July 1, just to kind of give timeline. But I think everyone's a little different. Some programs might pay you not until the second week of July. I know it's rare. Some places will give like a little bit of like a stipend for moving. I think that's probably more common for fellowships though. So kind of like what everyone was saying with the last question, try and budget as much as you think you may need to move. But that being said, I know a lot of schools, like a lot of comms will do like outgoing like interviews and outgoing sessions during their senior week or around graduation with financial advisors. I know my school has a couple that they use, and they have a couple sessions on like how to pay back loans, how to budget, which I found super helpful. And the school actually pays for them to continue to like give you some education after graduation. So I had a couple sessions with that team leading up to when I started residency, which was great because I had like not really had a job before residency for 2 years, but I hadn't really like had a job to this extent before. And so they were able to kind of give me some instruction on like how to budget and like how to, figure out what I would need to save and not save. And so reaching out to one of those companies I think is really helpful. You have a little bit of time now, which I know I just said like rest and do nothing, which I still stand by. But one thing I kind of wish I would have done is read the book called The White Coat Investor. That is awesome and huge. My boyfriend just matched and he just read it and he's like been summarizing it for me because I still understand so little about saving and finances, and it's written by an EM doc. So it's like written for physicians, like by a physician who understands kind of what we're going through and puts it in very simplistic terms. And so I think that's super, super helpful because once you start residency, you're gonna have more of a salary than you normally have. And yeah, Bree just put the link down there, which is awesome. It's not that expensive. And he even says in his book, like, if you have no money at all to be able to get it, like let him know and he will send you a copy because he understands how important this is for everyone. But you're probably going to get a lot of information about onboarding stuff from your hospital now, and they will likely your hospital will match you a certain percentage for if you like save money into your 401k, or my hospital has a 403b. So I would either talk to current residents or look into that. You might get a little bit of education on that during your orientation, but kind of once you start or during your orientation, figure out what your hospital will match as far as money that you can save and make sure you optimize that. So if they're going to give you like match, if you put in like 5% of your salary into whatever funds they have, and they will give you 5% as well, like optimize that so you get as much savings as possible. So I would say try and like reach out to if your school has financial advising now before you start. And then once you start, kind of figure out what your hospital matches and read The White Coat Investor and kind of follow along with his stuff, because that is definitely super helpful. And he's way smarter than I am on all things money.
I would second that. I kind of took this question more when I was preparing for kind of like between now and your first paycheck. I second everything Maria said after the paycheck starts, but I tried to move very frugally. I recruited my parents to help me move and a couple of friends with a case of beer. It's not glamorous, but it worked really well. So that was really cheap. I will say that look into your different options. Moving like a moving company is for sure the most expensive way you can do it. If you utilize like a U-Haul or something like that, they buy per mile, which ends up, I mean, that was what was most cost effective for me. And also think about I would ask the interns who are in your program the unexpected expenses. So like paying for parking, you might have to pay for a white coat, you might have to pay for your badge. those sorts of things end up being a lot more expensive than I anticipated. Also ask if any of the housing places nearby like cut all your move-in costs for working at a hospital. The place that I live right now cut all my move-in costs, and the first month of rent was free because I was a Beaumont employee. So be sure that you ask all the questions, because the worst thing they could tell you is no. But the best thing could be a lot more than that. So that's what I would recommend.
Any other? I don't know if there's much more to say because Maria, you did a dang good job, both of you, Bree, as well as Maria. I haven't read that book either, but we do have these financial sessions at work, and they mention this book. It's been quoted very often. But I guess the last thing I'd add is, before you get an apartment or a house, maybe just do your budget in the sense of, how much you really want to spend on your monthly rent, because you can live frugally and move frugally, like Bree was alluding to, and save quite a bit of money, versus having like a really, really nice apartment, marble countertops, all that. It might be the time to kind of go for, in a safe place, but a cheaper living space to save your monthly, because that's a third of our expenses usually. So, but great tips there. So last question here before we get into the breakout rooms is, what was the onboarding process like in the months leading up to starting your residency program? So kind of how did you communicate with your program? How did they communicate with you? Any HR items that you can remember and require documents to submit before day one?
The most surprising thing for me was how long it took for me to get my license. So they email you a whole list of things that you have to get done, and they all have various due dates, and some of them are like months away, and you're like, oh, I don't have to do that one first. Get your license first, because it took me almost 3 months, and it was like kind of pushing it close to my start date, and that was a whole bunch of stress I didn't need. Depending on the state you're going to, my school was in Florida, my practice license was in Michigan. That was like a weird flip thing. Florida was really, really, really backed up in distributing like medical school transcript thingies, and Michigan was really backed up with licenses. So then it was like I was backed up times two. So just know that that can be very different. And then asking if there's like a Google Drive of information that is kind of like tips and tricks of filling out stuff from previous classes. We have a big Google Drive, but I didn't know about it until well after the fact. So don't make the same mistake as I did. And then one other weird part about my hospital is that I had to have a physical, like a well baby visit with my hospital. I couldn't just do it at my like primary care and urgent care. So I had to make a planned trip up here that I hadn't anticipated. So just remembering that, or learning and having like well informed of all of the expectations, importanto.
And filling out all that license stuff, I feel like is so freaking confusing. Like, I don't know if they make the questions hard on purpose, but I remember being so just like twisted around with how to answer all their questions. And our hospital has like an administrative person who was very, very responsive in like helping me answer questions and directing me to links that I'm sure I probably could have guessed and found on my own, but I was just like so out of my like zone. So I just emailed her a lot, and she was very, very helpful. So I would say if like the licensing process, I echo everything Bree said. But if the licensing like process or application is confusing, or if you're worried about how long it's taking, sometimes they have to kind of push something through on their end that maybe they're like not aware you've done your part. Like, definitely don't hesitate to reach out to your hospital administrative people, because they want you onboarded as much as you want to be onboarded.
Awesome.
Yeah, just kind of adding to that, I would just do it as early as you possibly can if you're like a procrastinator like I am. You'll start to find that starts getting a little bit of trouble come, May and June. So whenever you get it, try to get ahead of it as much as you can. And like everyone else has said, the admin has always been very friendly and understanding. So I think one time I had an issue where my fingerprint got smudged or something like that, and I had to redo it. As long as you let your administration know as early as possible, then they're usually, for the most of the time, they're pretty forgiving, and they'll tell you if you'll be okay. So I think, yeah, like everyone has said, pretty much. Um,
Also save the receipts of all of those things that require you to pay money because your hospital will reimburse you for them, but only if you have the receipts. And I didn't know that. So I accidentally spent a good number of dollars that I didn't have to, which was sad.
Okay, I loved all those comments. The fingerprints thing just made me laugh because we're currently doing our licensing for like our boards and for fellowship, and my friend just barely had to do that, and it was so frustrating. So give yourself ample time to do your license. It also, alluding to what Bree said, it took me 3 months as well for my Pennsylvania license, which they claim is like the easiest, but it ended up being very difficult. So most of the time, I feel like the onboarding process is very organized. They give you like an email, or they go through Workday or New Innovations, and they tell you exactly what you need to do before day one. And so as long as you tick all those boxes, you're good. But just if you don't, on some of the ones that are legality, like legal oriented, you could get your contract terminated. So it's definitely very important to make sure you do everything they ask, because there's a reason, even if it seems too much. So just remember that your contract is based off of, yes, they want you, but they also expect that you're going to do what they ask. And unfortunately, sometimes it's easy to forget, but they'll often remind you and give you like, 3 chances. So it's very difficult to make too much of a mistake, but it's an option. Okay, so let me ask one more question since we have a couple minutes here. So does anyone think it's necessary to study anything prior to starting residency, like for instance, preparing for level 3? Talk a little bit about that.
No, please don't. Enjoy your life. Live. You have until December of your second year to have taken it. And you have to pass it by like April of your second year. So don't start now. Plus, none of you have taken level 2 PE, which means there's still this weird transit time where your program director has to sign off on you taking level 3. So they're not going to do that till they meet you anyways. So don't do it to yourself. Just relax, have fun.
Yeah, 120% agree. Some programs will set deadlines for when you have to take it within the program. Like I know our IM program needs to take it by December of first year, but our EM program doesn't have to take it until May of first year. So you may have to take it earlier in first year, but again, like I think I did like 300 combat questions in casualty study for like 3 weeks, and I like very comfortably passed the passing score. It's like a 2-day test. It's kind of long and it's just emotionally taxing since it's a test, but like you'll be fine when you get to studying. I what's my train of thought? The like first day of intern year, you're all going to be starting on the same foot. Like none of you will have been residents before, none of you will have been interns in that specific hospital and that specific specialty before, at least I would assume so. So they're not expecting you to be like knowledgeable on everything and know all the procedures and be ready to like scrub into the OR and do things by yourself, like completely. They're going to expect you to have a thirst for knowledge and have a lot of energy and be professional and be willing and ready to learn. And I would take that energy with you on day one and then hit the ground running when you start. But until and residency, you will run and the whole time. So I would take the time now to relax and enjoy and get ready to start when you start.
I feel like everyone agrees on this topic since everyone shook their head no to not study. It's different for every specialty. Like most primary care specialties, you're good to go from your training mostly. And we have to remember that a lot of the information is repetitive. So you've seen it again. previously. And so it really wasn't that scary of a test. I didn't think. I saw things I had already seen prior. For us, however, in pathology, we don't see patients regularly. So it's a bit more, our specialty takes it very early. So I took it in September of my first year. We try to take it as close as possible to our fourth year of medical school because that's the most clinical experience we will have. I see patients still, but it's just a little bit different. And so I don't remember all of the, IV things and all the things that you're, hands-on stuff. So for us, it was really important to take it soon. So we studied a little bit more, but once again, if I didn't study, like if I did a little bit, what Maria did less than what I would have done, just because she got to do a whole year, but even then you're pretty good. I feel like your first and second exams get you where you need to be. Then you just kind of have to build a little bit on it. So I don't think you should use your summer or your, couple weeks studying for step 3 or level 3. I'm sorry. I just don't think it's going to add much. If anything, it'll just take away freedom, and freedom's about to get taken away for a little bit longer. So not to be negative, it's fine. It works out, but I definitely would enjoy your couple weeks. And plus moving is very difficult and it's going to be exhausting. So I wouldn't add it. But if you want to study, maybe leisurely read or something. I don't think there's a need for questions.